All right, so hello everybody from New Orleans. Feel free to say where you are joining us from in the chat. Welcome to the second event in the series Design Thinking Gumbo for this semester, where we're sharing with you a delicious mix of design research tools and methods to help you expand your taste for design thinking and design research. I am Leslie Ann Noel, and I'm the Associate Director of Design Thinking for Social Impact at the Phyllis M. Taylor Center for Social Innovation and Design Thinking. And Design Thinking Gumbo is led by our Design Thinking graduate assistants. Each graduate assistant selects a research method that they are interested in, and then we co-design a presentation to introduce the members of the public to this research method, and especially how to do this method remotely. And we've been focusing on questions around people's experience of the pandemic. So today's workshop is on storyboarding, and it will be led by Michaeline Anglemire. So I'll just hand over to her now. Thanks, Michaeline.
Hi, thank you so much, Leslie. So my name is Michaeline Anglemire, and I am a Design Thinking graduate assistant at the Taylor Center. I am a Master's of Public Health Nutrition student to discuss how storyboarding can be used within the scope of public health in the age of the COVID-19 pandemic. So just a note, if you would prefer to have closed captions for our workshop today and you're not currently seeing them at the bottom of your screen, there should be a closed captions icon right at the bottom. So just click on that and select Show Subtitle to have the captions appear at the bottom of your screen. Also, if you would like to be placed in a breakout room with one of our ASL interpreters, please send a private direct message to Shema Abdalal to let her know. So today we are going to be using Mural as an interactive way to understand storyboarding. So Natalie, if you could please drop the link. Thank you so much. So we just posted the link in the chat box, and now I will go ahead and start sharing my screen. So just to get everyone's creative juices flowing, we're going to start with a warm-up activity using Mural. We're going to do a little bit of drawing in this workshop, so this will be a great opportunity to familiarize yourselves with Mural and to maybe let go of any embarrassment or reservations you might have about your drawing capabilities. So everyone, please go ahead and click on that Mural link if you haven't already. If you're already there, that's great. And just a tip, when you're on Mural, you can actually hold down the space bar to help you move around. So you should see a little hand appear like that. So now I'm going to ask everyone, I'm gonna get out of presenter mode here for a second. I'm gonna ask everyone to move over to the toolbar on the left side of their screen, and you should get a little draw icon. You can select the thickness and the color of your brush or your pencil up here, and go ahead and click on that and choose one of these lovely boxes we have down here. And I'm going to ask you to draw just a crazy squiggle line. The loopier and crazier, the better. And just a note, if at any point you ever want to undo what you did, just in the upper left-hand corner here, you have an undo button. So yeah, just go ahead and draw some crazy squiggles. I'm seeing a lot of crazy squiggles. This is great. And I'm going to set the timer for 20, let's do 15 seconds for everyone to draw their squiggles. Oh, I'm loving the purple. This is great. These are all looking awesome. All right, that is 15 seconds. Thank you. Now I'm going to ask you guys to take that crazy squiggle and find a way to somehow make it look like a bird. So take your squiggle, look at it, and see what other lines, designs, eyeballs, wings, feet you can add to the shape you drew to help it look more like a bird. I'm going to put 15 more seconds on the timer, and let's see some birds. I'm seeing some of them take shape. Oh, this one's got lots of colors. I love that. Okay, time is up. Seeing some great looking birds. Check these out. So before we move on to the next activity, I just want to ask someone to maybe share about their experience a little bit. How did that feel, drawing using Mural and using this tool?
Oh, can we just talk?
Yeah, absolutely.
Oh, okay. I find it a little difficult to like draw things with Mural. I also wish I had read the instructions first because I wouldn't have drawn like a million lines and then tried to turn it into a bird. But yeah, I don't think it's difficult to use Mural.
I think the challenge is you don't know what you're getting yourself into once you draw your crazy squiggle, and then you're like, oh my gosh, now I need to make it a bird. So thank you so much for sharing that. Great. So thank you for participating in the warm-up activity. Hopefully you're a little bit more familiar with Mural now. So right now we're just going to jump into learning a little bit more about storyboarding as a tool and its applications within public health. So what is storyboarding and what does it accomplish? Storyboarding demonstrates a series of actions or thoughts with the ultimate goal of conveying information quickly and clearly. It shows a sequence of events using imagery or drawings, and it helps break down complex or confusing topics for a lay audience. Since storyboarding depicts a series of actions, it makes it easier to understand the steps in a series or process. What are the benefits of using storyboarding in public health? Since it uses imagery and illustrations, storyboarding can be used in low literacy environments to create or convey ideas. In the context of public health, storyboarding can be used when working in, for example, communities where there might be a language barrier between the community member and the public health practitioner. As I mentioned before, storyboarding can help to break down complex topics, and this is especially important in the field of public health. Topics such as disease transmission or how certain illnesses function in the body are vitally important for patients to understand, and communication surrounding these topic areas can oftentimes be lost in medical translation between provider and patient. Storyboarding can help with that. Also, for quickly and clearly conveying important public health information and ideas, such as the proper way to sneeze and cough into the elbow, or steps in proper hand washing, storyboarding is a great technique. So maybe you've seen this slide before or seen something like this before in a public restroom. A storyboard like this illustrates quickly and easily the best way to wash your hands. It demonstrates a different action in each panel. There's some text, but it's not text heavy, and you could understand the steps pretty easily just by the illustrations. This is an example of a storyboard about Zoom fatigue. Rather than illustrating a series of actions, it shows a series of thoughts and feelings. So this says, oh gosh, another Zoom webinar. I'm so sick of sitting in front of screens all day, but maybe this one will be fun and interactive. Maybe I'll get to connect with others and we'll talk about making the world a better place. Let's learn about storyboarding. So in design, storyboarding is largely used as a planning tool to help people envision the action steps in a project. Storyboarding can also be used to help envision how users might interact with a new product coming to market, and can be used to spark discussion about potential weaknesses in a product design and inform suggestions for improvement. One of the most common usages is within the fields of advertising and film to help plan out scenes before filming begins and to help make sense of the story. And much in that similar vein, using storyboards to pre-test a commercial to focus groups or a larger target audience is much more cost-effective than producing and shooting a commercial only to find out that it doesn't go over well or have the intended effect. How has storyboarding been applied in public health settings? For example, a study by Whittingham used storyboarding as a cost-saving measure to test the effectiveness of a public health campaign. The study wanted to measure the effectiveness of commercials used to communicate information about safe sex practices to teenagers. They used storyboarding to pre-test the commercial's message and gauge the effectiveness of the health information. Commercials are expensive to produce, so using storyboarding as a planning and pre-testing tool is a great and inexpensive option, especially if you're a public health project operating on a limited budget. Furthermore, a study by Lupton and Leahy found that asking participants in a public health workshop setting to design solutions using the storyboarding technique generated really creative insights and solutions that public health professionals could use. And this idea actually helped to inform the design of some of the activities for today's workshop. And these are some of the references I used to inform this presentation. So if you want to, you can come back and take a look at these if you would like to do some further reading. All right, so now that we've learned a little bit about the theory of storyboarding, we're going to have the chance to put some of it into practice. We're fortunate, if that's an appropriate word to use, to be living in a moment where we're seeing so many aspects of public health play out in real time. For example, the rollout of the COVID-19 vaccine has been a real-time example of how we're all part of the collective story because it impacts all of us. So we're going to give you an opportunity to discuss a few questions to help get your brain thinking like a public health designer. We're going to place you into breakout rooms in pairs, and you will have 3 discussion questions. There are 3 different sections for you to write your responses, which you'll write in the circular sticky notes next to each question. The 3 questions you'll be discussing in your breakout rooms are, do you think vaccine distribution could be improved? How so? Do you have friends or family who have told you that they're afraid of getting the vaccine? What are they afraid of? And how would you address someone's concerns about getting the vaccine? You'll have 5 minutes in your breakout rooms to discuss these questions. When we come back, we'll debrief, and then we'll send you back into breakout rooms where you'll use these answers to design your own storyboards in the next activity. For now, though, just focus on getting your brain into your public health and design thinking mode. So I think we're ready. Shema, can you please send us into breakout rooms? Hello again, everyone. As we trickle back in. I'm so sorry if things got messed up with the breakout rooms. I think maybe some people weren't with the original people, or you had more than one other person. But hopefully you were still able to have some really great conversations, and I see some pretty startling artistic talent with some of these. I don't know how you were able to draw the way some of you did, but it looks like you guys made some really great storyboards. So let's check them out. I'm going to share my screen again. And yeah, these are great. So who would like to talk a little bit about their storyboard and present it and kind of the thoughts behind it? And just tell me your breakout room number so I can zoom in.
We'll go first. Breakout group 3. Yeah, we're hovering right over there. So yeah, we got a guy in the corner thinking about getting the vaccine. Contemplating it. The second panel, he's calling or going online because we want to make this kind of open to, this was really just drawn very quickly, and there would be more things here. We're just putting the idea down, but basically the like list of like ways to find out how to get the vaccine. Third one is him running to a door which has the vaccine behind it, and then bam, there's his vaccine in his shoulder. Yeah.
That's great. Yeah, these images are awesome. Did you, in your breakout room, have any conversations about why these were important steps that you chose to draw for your storyboard?
Yeah, we were going with the, we talked a lot about like having it, be like the phone, like a phone call, so that it's not just like, oh, go to this website for people who don't use the internet. And I kind of thought about like having the person going, instead of having like a car driving, because not everyone has the car. So it's really trying to kind of use general and accessible kind of images. And I tried to avoid using words for anyone who might be kind of low literacy. So that's just kind of my thoughts behind it. Yeah. I know the thumb kind of looks like an arm, but
No, I totally got the
Yeah.
imagery that it was like someone just plunging that vaccine into their shoulder. I love that.
Yeah.
Were you in a breakout room by yourself or were you with a partner?
I was with Sarah, who was joining on her phone and had a hard time getting into the mural. So we just talked about it and I drew this stuff. So
Great. Well,
I
thank
have
you
a background in art, as you can clearly tell here. This is some of my best work.
It looks fantastic. Thank you so much for sharing. And I love that you brought up the element of, making it accessible to people with, making the information accessible to people who maybe don't use the internet or don't have transportation, or maybe who, aren't literate. So that was great. Thank you so much for sharing.
Yeah, you're welcome.
Would anyone else like to share, present their storyboard and talk a little bit about it? I saw Breakout Room 4 got smart and used some icons so you didn't have to draw people. That was really great. Would anyone from Breakout Room 4 maybe want to talk a little bit about this storyboard?
Nisha, you wanted to talk about it, right?
Yeah, I can talk about it. So we didn't get to finish ours, but as you can see, we kind of started with kind of like this person who's like happy, and he's kind of asking our person in number 2 about his like fears and stuff. So the first box is really this like kind of like awareness, like kind of trying to understand this person's fears. So like you can see like the little question, you can kind of see him like talking and asking questions. Yeah, that box.
Oh, you changed I see the order.
Yeah, we changed the order because we were like flipping things around and like trying to make decisions. So he's asking questions, and then our person number 2, these are like all of his fears, and we like pulled these fears from either things that we've read online or things that we've seen. So like there's infertility, there's like the person getting a microchip, there's like the zombie apocalypse. And then the number 3, we were talking about like, so then this happy person begins to talk about the benefits of getting the vaccine. So like caring about their family, maybe like, we just got, like the CDC just said something about not having to wear a face mask after 2 weeks, being able to travel if they like travel. And then number 4, we were hoping to be able to actually tell the person how they can like get the vaccine, and like they were going to have like a smiley face and be confident about getting it, but we didn't get there yet. So that's kind of what our storyboard looks like.
That's great. Thank you for sharing. So did any of you in group 4 maybe feel like using the storyboarding technique helped you organize or communicate your thoughts better, or maybe in a different way than you would ordinarily?
Sure. I think like you can see, like we remodified the order. So it made us rethink like how do we approach the problem, and starting with questions and starting with kind of empathy, I think was kind of what we learned from storyboarding.
You see, starting with empathy.
Yeah.
That's a really great, I really like that. It's a great kind of takeaway.
Yeah. Have you visited your family lately?
Me personally, or are you presenting that to everyone?
I'm presenting that to you. Just that's one of the questions in box 1.
Oh, I see. Right. Sorry. Have you visited? Yes. Right. Yeah, you got to start with empathy. Personally, I haven't seen my family in a while because of this.
Why do we have a vaccine for you?
I'm so sorry. Were you presenting that to everyone?
No, I'm just saying as a joke, because that's sort of the storyboard, is asking them questions and then realizing that being able to see your loved ones might be a way for you to get the vaccine if you're afraid of it before.
I see what you're doing there. That's great. Well, thank you so much for sharing Breakout Room 4. We've got some other really great. Oh, go ahead.
Emily?
Okay, I was gonna add that so I work with like a team of educators, and we do a lot of projects, and we've been using like Google Slides a lot, where we'll one person kind of writes in the notes on that, and that's how we stay organized. But I really like this because it helps distribute the work, and also might help, you know, increase engagement from everyone on the team, if they have the chance to be like drawing at the same time. And I felt like we did this in person a little bit, and so this is a really fantastic way to do this in the virtual setting. So yeah, thank you for this.
Thank you. Were you also in Breakout Room 4, Emily?
Yes.
Great. Yeah, it seems like you guys really thought outside the box. Or inside the boxes, I guess. So we've got a couple more storyboards on here that look really interesting. I would love to hear some more, maybe from Breakout Room 1, 5, or 2. Would anyone want to share?
I guess I can go for Breakout Room 5. So for ours, we started with like getting on a wait list, because in some states you have to get on a wait list. You can, once you're eligible, you can apply to be on a wait list. And so we have our person signing up to be on a wait list, and they receive an email that they can go get their vaccine now. And then we have our person having to take public transportation to get to their vaccine location or clinic. So they're going to take a bus. And then the last one is them getting the shot by a med student, because that's what was going on at Tulane. So, and a lot of the discussion that came up was, we were thinking about how there's a lot more steps to getting a vaccine than people realize, or that goes into getting one. And this like had us thinking about, oh, what's all the steps that you have to take, whether you have to take public transportation, or signing up for a wait list, or making it a direct appointment, because it's different everywhere. So yeah, that's kind of what we talked about. I don't know if anybody from my group wants to add on to anything.
I'll just say, yeah, Natalie.
Thank you.
Well, great. Thank you so much, Room 5. I really like the part where you mentioned them taking public transportation. That's kind of similar to the other one we saw. I believe that was Breakout Room 3. Really kind of playing on, you know, maybe there's no car in this situation. So kind of thinking from all angles. That was really great.
A question?
Yeah.
Michaeline, Mark has a question.
Oh, yes, absolutely.
Hold on just a second. Mark just disappeared from my screen. This is the interpreter, so sorry.
Shema, can you spotlight Mark?
I was watching him, and the second he opened up to say anything, he went somewhere else. I'm trying to find him.
He is spotlight, that's why.
You can probably change the participant view on the top right.
There we go. Got it. You can see you now. I don't know what happened. Okay, go ahead. Okay, so yeah, you know, we've had experiences with this app. We discussed kind of how, let's see, how, you know, we wanted to make our storyboard, what we wanted to start with. So we decided to set up number 1 with 2 people who were chatting. And the person on the left had concerns, and the person on the right was basically just informing the other person of, just lost Mark again. Hold on just a second. I don't know why that keeps happening. I have him pinned. So yeah, so there are 2 people in that first box. And the person on the left has got questions about basically what to do, what's needed. The person on the right is basically the medical professional, the doctor, the provider, nurse, whoever that is, who's going to be answering those types of questions, explaining the benefits, and yeah. So anyway, that's kind of what we did, and that's what we talked about. Sorry, the interpreter missed some of that, having to find him. So feel free to ask questions, you guys.
I apologize. I think that was me coming in and out of screen sharing mode. I think that caused something to happen with Zoom where maybe the interpreter wasn't able to see your video, Mark. So I'm sorry about that. But that's a really great perspective that if someone has doubts and questions, ask a medical professional, kind of posing them as the experts. That's something that I think has been a little bit confusing with the pandemic, is that everyone kind of maybe has their own opinions about things, and listening to professionals is a really important way that we're going to make it through this pandemic. So thank you. Who were you with in your breakout room, Mark? Was it like a whole bunch of people, or not sure if, yeah, anyone else wants to talk maybe about their thoughts, or if you wanted to add more?
I'm trying to remember. There were a few people with me. There were several people in my group, and myself, of course, yeah.
I will confess to being the artist for Breakout Room 2. So just so we all know, that's on me.
I think it looks great. So just a question for Breakout Room 2. How do you feel like you could maybe use the storyboarding technique in work that you're doing in your professional life, or maybe your personal life?
I'm gonna use it on my next date. They're like, look, we're gonna go to dinner first, and then we're gonna eat dinner, and then we're gonna finish with dessert.
Well, I figured out that Kwang is a comedian, so I'm trying to to figure out, okay, is he speaking with a straight face, or is he speaking? He wants us to laugh, but actually, my son and his cousin. So my son is 13 and his cousin is 13, and they've used storyboarding remotely. The cousin lives in Florida and we're in New Orleans, and they've used like Google Jamboard to draw out some things that they wanted to do with some kind of gaming stuff that they wanted to do together. And they didn't feel like talking or writing, and they actually drew a kind of storyboard. It's not work, but it's a way that people might have used it in real life.
Yeah, I think there's a lot of collaboration advantages of storyboarding. And as you notice, it's not so much storyboarding by yourself, but with a group of people. I think there's a lot of alignment happening, and then there's a lot of ideation happening too. That's really, really nice to have when you get everyone kind of in front of this one panel and sort of come up with ideas and the flow of those ideas.
Yeah, absolutely. That was the goal, to collaborate and create something together. And not to put you on the spot, Breakout Room 1, just wondering if you guys wanted to share. If not, no problem at all. We could just move on to kind of our closing and a little bit of a debrief. Okay, that's okay if you don't want to share. It looks great, honestly. I'm loving all of these. So yeah, we touched on a lot of these questions already, but just kind of some really interesting things to think about when you're exploring the implementation of any sort of design technique. Did you feel like that technique, in this case, it's storyboarding, helped to organize or communicate your thoughts better? How could this technique be used in the work that you're doing? Who might this technique allow us to reach that is historically difficult to reach? And what are some maybe potential challenges and limitations to storyboarding? I'm not sure if anyone had any thoughts about that, or maybe wanted to share anything else that came up in your breakout rooms, maybe something that came up during the first activity, just kind of opening the floor for some more discussion.
I can share one thing that, oh, sorry, did I just cut someone off?
Go ahead.
When you were talking about who might we be able to reach with this technique, I was wondering if this could work well in schools or, with youth. It's a more like, visual, and it's like a fun way to tell a story together.
Yeah, absolutely. That's a great point. When I was looking for like an example of the hand washing slide that I had, so many of them were geared towards children, because you're right, kids learn better in pictures and limited words, especially if maybe they're a lot younger and don't know how to read yet or are still learning how to read. So that's a really great thought, that it might allow us to reach children. Thank you for sharing that. And Aaron, was there something you were thinking? Oh, I'm sorry.
I can go really quickly. Sorry, I think mine's a little bit delayed, but so I was just going to say it can be able to be like in communities with low literacy. I feel like storyboarding, especially with visuals, it can come across to different populations, different cultures, everything. It's just a really good communication method, especially in hard to reach populations.
Thank you.
I was going to share a limitation might be, well, I think you did a really good job at the beginning of saying like, being inclusive and like, just put it out there. It doesn't matter what your drawing looks like this is for, practical purposes. I could see some kids maybe getting like tripped up by like, I don't want to, being nervous about drawing in front of other people. So maybe like if I were to do this with youth, maybe encourage like them to write or draw, like write words or draw, so that they can use either technique. So I could just see some of them like getting tripped up about it, even if you create a pretty like inclusive environment.
Yeah, absolutely. I could see adults getting tripped up by that. Not just kids, for sure.
I mean, I like this because I'm a visual learner. I don't really pick up anything from like lectures. But I think something I really like about it is it kind of makes you have to think out all the steps of a project. Whereas I think kind of writing out sometimes there's like kind of gaps that this might be able to address a little bit more. It's just another way of thinking. I think sometimes like having a Word document or something open and like kind of writing things sort of linearly like that can be sort of limiting. So just being able to like draw and move things and put them in different orders. I think it's just a good way to like, ideas can be so abstract in our brain, and getting them out on paper is not going to look like a written document. It could look like a really messy doodle. And so, if you can get it out of your brain and get it on paper somehow, and then be able to rearrange it, I think that's great.
Absolutely. Yeah, thank you so much for sharing that.
I'd like to say something real quick. The actual, when you were showing the stuff before, in the format that you were showing it in, it actually looks like infographic. I don't know if anyone have ever heard the term before, but it's a design term as well. So the way how we use the storyboard, it could be viewed as an infographic as well, a way of communicating visually. And you could do it both ways. Either you use words or you just use images. So I'm very familiar with the way and the methods that we're using this evening. So yeah, this is a good way to communicate if you want to get your message across visually.
Great, thank you so much for sharing that and throwing some design terminology in there as well. Infographic, that's a great term to have in our repertoire. Well, thank you so much, everyone, for sharing. I think we had some really great discussion today. I just wanted to plug really quick a couple other events that are going to be coming up with the Taylor Center. We're going to be having our Design Thinking Breakfast with Raja Shar on March 26th at 8 a.m. And also please join us for the next installment in our DT Gumbo series, where Naisha Ford will be talking about personas on April 7th at 6 p.m. So those are some events that we have coming up.
I know, Michaeline, I'm just going to interrupt for 2 minutes. I just know that 2 people had 2 burning comments. So I don't know if they still want to share. I know we're at time, but if Mark and is it Simon did have their hands up for a little while. So I don't know if we could let them share.
Of course. Thank you so much for catching that. I'm sorry I didn't see the hand raised.
I'm cool. It's not burning.
It doesn't have to be burning, but you can share. But I just wanted to acknowledge that I saw both of them with their hand up.
Yeah, Mark is saying, yeah, I just wanted to share a story just about a discussion maybe that we had, and just realizing kind of a sort of an interesting perspective, that being of the deaf community, and just understanding the problems with getting information out in ASL to that community, that we can't overlook the importance of providing information in ASL for the deaf community, as that's their native language. And going forward, that should be something we're thinking about in public health, because presenting information in ASL, and I think that this can help with that, you know, things with the vaccination and just keeping those concepts of storytelling simple, and making sure it's not too reliant on English is something that's very helpful for the deaf community. So I just wanted to mention that as something to be thinking about.
So I also want to, you know, Mark, thank you for helping us in helping us make this workshop much more accessible. This semester in particular, I've had to deal with accessibility issues on different levels. I teach another class where there is an ASL instructor every class. I was diagnosed with some hearing loss. My mother has some hearing loss. So, you know, I think that these really are some questions that we do have to bring into all of the work that we're doing. So I'd really like to thank you for bringing, well, for helping us to make this workshop accessible to people.
Thank you. Thank you.
Yeah, thank you so much, Mark. If you don't mind, I do have a question about making public health materials more accessible. So when you say not focusing so much on having materials in English, do you also mean written English? Is that something that maybe we should be considering having options available in ASL, or would that be more like media, such as like videos and things like that?
Well, just for example, I mean, you know, in using, one second here. So just these concepts for video materials, for doing things over Zoom, you know, different things like that. It's just so important to have things available in ASL. You know, the concepts that we can show, you know, it's not a linear language. It uses space and imagery and facial expressions and body language. And, you know, it's so much more than what English can portray in a linear sentence. You know, you're thinking about, everything we can show with our hands and our faces and the way that that communication happens. And I think that that's sort of an interesting thing then with the storyboarding, bringing that back, because we can add that visual element that just written English does not do. So we can show facial expressions on a doctor, or show the emotions of a person in a picture that's just more identifiable than something in just an English sentence. So I think that that just makes things so much more accessible. And like, I do enjoy this idea of the storyboarding, but it is still a 2D picture. So it does, lose something that ASL in a video style format could convey, but I think it's definitely a step in the right direction. So I hope that answers your question. Does that answer your question?
It does, yes, thank you. I never thought about, all the dimensions that written English are kind of lacking. So that's a really, really great and valuable way to think about the way we communicate, especially communicate public health messaging. So thank you so much for that perspective.
So now I know we're over time. I guess I'll jump in very quickly and say, I know we mentioned these before. We have some events coming up. We have Design Thinking Breakfast on, I don't remember the day. I know it's, I can't read.
March 26th.
Right. And I had dropped in a link in the chat if anyone would like to sign up for that one. And then in April, we have another Design Thinking Gumbo personas. Do we use them or not? And one way to find out about what we're doing is if you follow our Taylor Eventbrite account, you'll get notifications when we create new events, or if you sign up for the Taylor Center newsletter. My goodness, I don't have all of the links, but you'll get this information in your inbox if you visit our website at taylor.tulane.edu. And so I'm going to say that brings me to an end, but this is Michaeline's workshop, so I'm actually going to hand it over to Michaeline to close.
Thank you so much for that, Leslie. So I know we're a little bit over time, so I apologize. If anyone would like to network or connect, feel free to drop your LinkedIn links in the chat so we can maybe get a little bit of networking started. If anyone wants to learn a little bit more about upcoming design thinking events and everything, I know maybe you could connect with Naisha. But yeah, thank you so much for being here today. Go ahead and stop sharing my screen so I can see all your lovely faces. And yeah, I really appreciated all the perspectives you brought and all of the really interesting conversations we had. We hope to see you at future design thinking Gumbo events that we host.
Okay, thank you.
Thank you.
Great, thanks so much.
Thank you.
Thank you.
Thank you.